my dad, for the ones who don't know, that's my dad, Dr. Schönwälder. You can try to share your screen. I don't know. Willst du erst Hallo sagen?
Yes, hello. Hello, everybody from Hamburg. We have a nice winter day over here, and I'm not very used to speak English anymore, so maybe I need some help from the right. Okay. In this presentation, we will talk a lot and see a lot of normal and not normal X-ray pictures. If you're interested in MRI or CT, you have a lot of possibilities in the net, but the plain X-ray is the beginning of the procedure. Okay. After the morning speech, I turn off my camera because I have to concentrate on the pictures and on the English. Anyway, okay.
Everyone see the presentation?
Yes.
What about the pictures? You can see it?
Yes, everything.
Yes.
Yeah.
It is very important that the light in the room is a bit dimmed. Otherwise, you can't see the special things on the gray and white stuff. On the left, you see my hospital. There's a hospital on that area since about 130 years, but only the trees on the right side are about that age. Everything else is quite new, and it's in the east of Hamburg. On the left, you see a sort of advertising about a special drug against pain in the articles. And there are a lot of percentages presented, and I look after these numbers, and they are quite good. And you see the knee is presented with about 62%. That means people above 60, but the other hand is they must be obese, and the more the weight comes up, the more pain in the knee is expected. The drug is devil's claw. The cost is about 60 euro, and the price is not pointed out on this advertising. It's quite high, I guess. But devil's claw is a substance against pain since the Middle Ages. Okay. Knee, very important. On the right side, you see X-rays, normal X-rays, and the point of maximum will be the lateral view of the knee. And you have to learn about these things because a normal X-ray is triple S. That means short, safe, and simple. And you don't have very much radiation explanation with a normal X-ray. Okay. On the left side, you see a normal X-ray. On the right side, you see a knee which is traumatized. Very important is the soft tissue around the knee. At first, we make a check of the bones, and then we have to look at the soft tissue. Before we try to analyze an X-ray, you have to know the history. You have to know where the pain is. Actually, the best is you have to see the patient and you do an examination of the joint. This is pretty normal, but in the end, I will tell you about the 5 Ds, and that's the carry home message actually. The left one is a 3D picture, which is quite, it's like advertising, but you don't need it. Okay, imaging tools of joints and imaging tools of the knee. Plain X-ray. Does anybody know what this is? We come to that. Scintigraphy, sonography, very important in children. CT, sagittal view, and MRI in the modern days. But very often when we start with MRI, we need a plain X-ray afterwards to get the final diagnosis. Okay. Plain X-ray. You have to analyze the soft tissue surrounding of the knee, and you have to analyze the bone structures. What you see on a plain X-ray is the different kind of densities of the tissue. And what you always have to keep in mind is there's fatty tissue is no problem for the X-ray, so it's presented dark. The muscles are middle gray and the bones with calcium are bright. The most bright structures are metals. We will see that later. This fatty tissue is very important to get a diagnosis. Is everybody familiar with the anatomy of the knee? There's a very special part of fatty tissue. It's called Hoffa's pad below the patella. And this is one point where you have to look at. Another point is to look above the patella, below this linear structure. This is the tendon of the quadriceps, and this anterior department of the knee is very important for knee diagnosis. If it's trauma, if it's infection, or if it's degeneration. The normal X-ray is just an AP and a lateral view. And the best pictures you get when the joint is just in the middle of the picture. This is not the best centration. This is better. And the third view is an axial view of the patella. Okay, this knowledge is not new. These pictures on the left are from the 30s, 1930, and you have all these linear structures pointed out. The Hoffa fat pad and the distance of the patella, condyles, tibia, fibula. Okay. And all these structures and lines you have to find on a normal lateral view. The anterior view is important for the axis and for the joint cleft. It must be smooth, and the fat on the side should be not infiltrated. So there should be dark structures around the knee. In this picture, they try to put the axis into this picture. If you do it right, you have to make pictures in the standing position and pictures of the whole leg. So this is just schematic. Okay. X-ray, normal X-ray, and very old pictures how to do these X-rays. This is a special kind of getting pictures of the patella, axial view. The tube is positioned down here and the patient holds the plate. So you get pictures like this. This is a very interesting view with 135 degrees, but if the knee is rotten, you never will get these sort of pictures. It's more orthopedics. Okay. We have a lot of variants of the patella. A symmetric patella with medial and lateral joint is very rare. Normal is that the lateral part of the joint is bigger than the medial, and most of the patellas look like this one. In the next picture, you see that the calcium is gone, osteoporosis, and we have degeneration of the joint, which is very common. What's wrong over there?
Maybe give them a minute.
Hopefully there's no fracture, but obvious the ligaments of the patella medial are luxated, and so we have a subluxation. And the pain in the examination is in the patella, and this is the typical picture of a non-dislocated fracture of the patella. We have a normal patella, axial, and we have normal MRIs. And the anatomy is best seen on the MRIs. What we do in our institution is that the patient put a vitamin capsule to the point maximum of pain. Don't forget that, it's very important. In the end, you have a lot of pictures, a lot of views, and nobody could remember where the point of interest. Okay, that's very important. And these vitamin capsules, they are oily, fatty content, so you can see them on the MRI. We do it with any joint question, right? Okay, we need MRI for the ligaments, for the cartilage, for the bones, effusions, even blood vessels can be seen on these normal MRIs, and the time to get such a knee examination nowadays is about 10 to 15 minutes. So it's pretty easy done. Okay. Let's start with some examples of lateral knee pictures. What about the left? Just to keep it simple and have this picture in your brain, that's a normal lateral view of the knee. The picture in the middle, this is from the jogging pants, but this is not normal at all. There was a trauma. What's wrong in this picture?
It looked like the patella is too far up and the tuberositas of the tibia might be fractured.
At first, the picture is presented much too dark. Okay, so we can't analyze the soft tissue in this area. The tibia so far is quite normal, but what we see is that we have a fluid level over here. We wait and then we see. What about the picture on the right?
There, I would have said now it's looking more like in a child, so we can see the growth plates have not fused yet.
Yes, a younger guy or girl. And what you always keep in mind, pediatricians do at first ultrasound. Even if they have questions for fracture, normally they do ultrasound. And they are very high skilled, by the way, even to analyze fractures with ultrasound. But in the end, they do X-ray. And in this case, we have a soft tissue, a big soft tissue wound. In this case, you can't see it very good, with air in the joint, a laceration of the soft tissue and no bony disability. Okay. This is normal again. Little bony structure over here is the fibula, and in about 30% of people we have these fibula, which is a small patella on the back. When we presentate the picture in the right way, you can't see the fluid level much better. What you never should forget is this phenomenon comes from a fracture. We can't see the fracture, but this dark structure is fat marrow from the bone. For this picture, the patient is lying on his back, so the level is actually like this, but fat swims up
On the surface.
right? So if you have effusion and fat in the joint, you always be sure that there must be a fracture. We can't see it on this picture, but it is there. Okay. And this is not very much different, but you can't see this air a bit better than on the first try. Okay. Any questions to this?
No.
Lateral views, and we go on. What about the left? A young people or an old people?
Old people.
Maybe even disabled, but we can see that the bony structures are quite transparent. So we have severe osteoporosis in this picture. And what else?
There is no spacing between the joint.
I think there is a space, but it is not an exact lateral view. Okay, so one condyle is over here and the other is here. So we have not a very good centration of the lateral view. But when you see this contour and that contour, you have a space over there. But what about this?
It's dislocated.
It is too high. And it has a new special joint. So we can say it must be chronic. And this is called patella alta syndrome. And the reason is that the ligament, the patella ligament, becomes longer. In some older patients, sometimes after trauma, without repair. Okay, what we see in the middle picture.
A bone tumor.
Right. What sort of? What should we do? Well, at first, we have to know why this X-ray was done. And in this case, it was a young soccer player and he has pain in his knees. Okay. We see fat over here. We see fat over here, and we see fat here. So we don't have any signs of fracture, but we see these irregular structures within the bones. Okay. We need the second view. In this case, I don't have it. It's the most common tumor in children. It's an enchondroma, and it's benign, and it's so-called don't touch me lesion. So just put it in your report and then nothing else. Okay? Enchondroma, benign, most common benign bone tumor. On the right, it becomes harder. What about that? Knee pain. And what we see is lots of effusion in the suprapatellar space. So there's something wrong. And another thing you always have to keep in mind, if you have fluid in a joint, there is no sort of examination how you can define this fluid. So if it is unclear, you have to make a puncture of the fluid to analyze it, okay? We can't see much of the fracture. In this case, clinical examination helps. If there was a trauma and you have a big tumor around the knee, then maybe it's blood.